Welcome to our January seminar as part of the Prevention Research Center for Healthy Neighborhood seminar series. Before we get started, just a few logistics and housekeeping for today's seminar. We recognize that in this format, you can't see who all is on the call. If you could please use the chat feature to write down your name and organization to let others know who is here and joining the presentation today. For questions, we ask that you please use the Q&A feature. Also, there's a raise your hand feature which you can use during the question and answer periods if you would like to request your microphone to be unmuted. We are excited to have Katrice Cain with us today for our seminar. Ms. Cain is the Racial Disparities and Health Equity Program Director at First Year Cleveland. And the presentation today will be on strategic approaches to address racial inequities in maternal and infant health outcomes. The Racial Disparities and Health Equity Program mobilizes the community through partnerships and a unified strategy to reduce infant mortality in Cleveland and Cuyahoga County, Ohio. In this role, Ms. Cain oversees, aligns, and coordinates strategic approaches to support women and men who have experienced pregnancy and infant loss, address racial inequities in maternal and infant health outcomes, and ensure every baby has an opportunity to survive and thrive. Ms. Cain has over 10 years of experience examining and addressing cultural, social, and environmental influences on health. Her knowledge and expertise have contributed to the design and implementation of culturally tailored community-based research studies, programming, and educational tools. She has conducted numerous training workshops and presentations, as well as published peer-reviewed articles in her areas of expertise. Fueled by her passion to serve, she is dedicated to advocating for equity through sustainable community, institutional systems, and policy change. Ms. Cain received her Bachelor of Arts degree in psychology from Kent State University and a Master of Arts degree in clinical mental health counseling from John Carroll University. I'd like to welcome Ms. Cain.
Thank you, Sarah, for that wonderful introduction, and Happy New Year, everyone. It is a pleasure to be here with you today. As mentioned, my name is Katrice Cain. It is a pleasure to be here. As I mentioned before, it's an honor anytime I have an opportunity to speak on behalf of the work that we're doing at First Year Cleveland. Okay, there we go. All right, so for this afternoon's presentation, I want to provide you with an overview of First Year Cleveland. And I'm going to review some of our local infant mortality data and discuss some of the work that we're doing, how we're engaging the community around this issue regarding infant mortality. So First Year Cleveland is what I call and what we call a community movement, a community collaborative. It was established in December of 2015, so we have hit our 5-year mark. And it was established by 13 civic leaders. This is the county's 4th attempt to address this issue around infant mortality, which has been persistent for over 50 years, the crisis that we have. We have over 400 community partners that includes faith-based organizations, members of our healthcare systems, leaders, nonprofits, for-profits, grassroots organizations, and especially families who've experienced pregnancy and infant loss. So this is a grassroots bottom-up approach. So we are making sure that those who've experienced loss, our community residents, those who live in our neighborhoods are driving the work, that we shed light on their experiences, that we speak to them, that we understand what is it that they are dealing with in our communities and how can we address some of the issues that they face. So their experience and their wisdom is the forefront of the work that we do. We can't do what we do without them and being involved. Our vision is that every baby born in Cuyahoga County will celebrate a first birthday, and our mission is to mobilize the community through partnership and a unified strategy to reduce infant deaths and racial disparities. As I mentioned, we've hit our 5-year mark. We're actually in the process of a strategic planning process. If you are interested in learning more about that process, you can go to our website, firstyearcleveland.org, and we have some materials that will give you some insight into what we're thinking of, regarding this next phase of First Year Cleveland. We've really taken the past few months to speak to our partners, to speak to the community, to really examine and assess what have we done, lessons learned, and where do we want to go moving forward. It's been a very exciting experience. It's been very eye-opening. I think that it's critical in this work. So if you have any questions about the plan, where we're at right now, after you go to our website, I'm happy to answer any questions, and we'll make sure that we keep you updated on where we're at and where we plan to go. So First Year Cleveland has 3 top priority areas. The first one is to reduce racial disparities, and I'll give you some information about that later. That's our #1 priority. The second one is to reduce extreme prematurity, knowing that prematurity is a leading cause of infant mortality. And then the third is to reduce preventable sleep-related infant deaths, because we know that within the past 10 years, sleep-related infant deaths were preventable. There's something that we can do about it. So we are focused in ensuring that we have community awareness, that there's education, that we ensure that, that our healthcare systems, that, other systems, that parents, expectant parents, new parents understand safe sleep practices. The focus of today's presentation will be on our first priority area, which is to reduce racial disparities. But as I mentioned before, if you have any questions about the other work that we're doing, the other priority areas, I'm happy to provide more information. Within these 3 priority areas, we have 11 action teams. These action teams are led by members within our community. They are part of our systems, and they work on different programs, research projects, interventions that align with one of these priority areas. And you'll learn a little bit more of what 2 of our action teams are doing around reducing racial disparities. Just so that we're all on the same page, I always like to include this slide that defines what infant mortality is. It is the death of a baby before his or her first birthday. And you'll hear me talk about the infant mortality rate, which is the number of babies who die in the first year of life per 1,000 live births. And then you'll see the calculation at the bottom. This is one of my favorite slides and most important slides that I always include in my presentations, because when I'm out in the community and I talk about infant mortality, essentially sometimes there's blaming and shaming. People will say, well, what are the healthcare systems doing? What are the mothers doing? What are the fathers doing? And it's always sometimes pointing of the fingers. Sometimes they, these people over here, these systems over here. I want to be very clear that this issue around infant mortality is an us issue. It's a community issue. It's a we issue. It's essentially a community mirror. It's reflecting our collective capacity to promote and protect the health and well-being of our very youngest and most vulnerable. And I encourage you, I charge you, that when we're thinking about infant mortality, when you hear the data, when you hear about some of the information I share with you today, that you really start to ask yourselves, what can I do? Within my department, within my organization, within the system that I work in, within talking to family members and colleagues and friends that I have, what can we do to combat this issue? Because it's all of us that are responsible, that need to be held accountable for what we've seen in our communities. And all of us can do something in some way. It's also multifactorial. The rates reflect the society's commitment to the provision of high quality healthcare, adequate food and good nutrition, safe and stable housing, the psychological and physical environment. I'll talk a lot about stress, and sufficient income to prevent impoverishment. So back in 2015, when the civic leaders came together in thinking about forming First Year Cleveland, there were a lot of community conversations. There was a lot of talking to systems leaders, to leaders within the county, within the city of Cleveland, talking to parents, talking to individuals who've experienced loss. And what was noticed is that there were different perceptions about this issue around infant mortality. Many people thought that babies were dying due to poor or no prenatal care. In reality, actually looking at the data, we found out that Cuyahoga County has had the highest rate of prenatal care in the state and the worst infant mortality rates. The #1 thing, even to this day, that I hear, that this issue has to be solely about poverty, and that's not the case. Black babies are not dying solely due to poverty. We know that there's a split between Medicaid and private insurance. And then there's conversations about well, this must be an issue around teen pregnancy or substance abuse, and we know that's not the case. it's important that we assess our assumptions, and that's with any work around health disparities and health inequities, and health in general. What are our beliefs? What are our perceptions? What are the assumptions that we're making about why we have these health issues within our communities? What are our perceptions about the people who are facing these issues? What are our perceptions about the neighborhoods that are right in our backyards, especially if you're working within our local healthcare systems, or if you're working at Case Western Reserve University, you know, walking around the neighborhoods. When you go home and you talk about the work that you do, when you talk about the people that you serve, when you talk about the neighborhoods within Cleveland, how do you describe them? Assumptions can no longer drive the work. We need to face reality. We need to look at the data. We need to use qualitative and quantitative data to drive this work. So that's one of the biggest things we realized within this work of First Year Cleveland, is that assumptions will no longer work. We need to face it. We need to understand it. We need to be critically thinking about this issue around infant mortality and how we can mitigate it. So here's what we know. We know that Black mothers have the highest incidence of premature babies, that this issue around infant mortality has been persistent for more than 50 years in Cuyahoga County, way too long. You know, one baby dying is way too many, but the numbers that we've had is disheartening, is problematic, and that this issue has been persistent for over 50 years. As I said, going back to that community mirror, what does that say about the city of Cleveland? What does that say about our county? There's a problem. We know that Black women at every socioeconomic level have higher rates of infant mortality than white women with less than a GED. That goes back that this is not solely about poverty, that this is across socioeconomic status. And that just last year in January, there was a City Lab study that showed that Cleveland is the worst large city in the United States for Black women's livability. So if we're talking about Black infant mortality, and we know just what that study found, that shows us that there's a problem. There's something going around with the Black experience, particularly among Black women. And what is that saying about how they're able to carry pregnancies through full term? And then what happens when they have birth with these babies? I also want to shed light that since 2015, there have been some highlights. You know, we have made progress. We know that there's a decrease in the overall infant mortality rate. It was 10.51 in 2015, now it's 7.0. There's been a decrease in premature infant deaths and births. We've seen even more decrease due to COVID. We're still trying to figure out what that may be related to, but we've seen some progress with that. There's a decrease in the number of babies born at 22 weeks or less. The white infant mortality rate is 3.40. In 2015, it was 5.77. And then the Black infant mortality rate is 13.26. It's the lowest since 2015, which was 18.45. We have done an amazing job decreasing the white infant mortality rate. Yes, we've seen progress within Black infant mortality rate, but 13.26 is way too high. There's more progress that needs to be done. When we look at national, we know that Black babies die 2 times the rate as white babies. In the state of Ohio, Black babies die 3 times the rate as white babies. In the county, Black babies die 4 times the rate as white babies. And in the city of Cleveland, Black babies die 7 times the rate as white babies. These numbers are alarming, to say the least. So what we do at First Year Cleveland is we pay close attention to this. And as I mentioned, this is our #1 priority area, to make sure what can we do to decrease these inequities that we see. So I told you a little bit about First Year Cleveland, you know, how we were established, why we were established, some of these assumptions that were made. But then it goes back to, okay, so we have these inequities. If we see that the Black infant mortality rate is so high, what could it be? What could be the cause? What could contribute to this? You know, these are common questions that we've had to grapple with, and that many of our stakeholders and that we're trying to have these community conversations around to change the narrative about infant mortality. We have to look at the Black experience in the United States. This is a slide that one of our consultants, Dr. Arthur James, who's amazing, he has created this slide and a few others that I will show you later today. But this shows you the Black experience since 1619. And this is for over 402 years of dealing with 87% of our experience as Black people living either as slavery or under Jim Crow. Racism has been rooted in the foundation of our country, and it spans over generations, the impact, the consequences of it. It affects Black Americans significantly, and we see it throughout how they birth their children and their experiences, and how they're able to provide a nourishing environment for their babies. We know that racism is a system of structuring opportunity and assigning value based on the social interpretation of how one looks. It unfairly disadvantages some individuals and communities, and it unfairly advantages other individuals and communities. It saps the strength of the whole society through the waste of human resources. So we think about the different types of racism. We know that racism permeates every aspect of one's life. We think about it between individuals, within institutions. We look at the policies and the practices and the inequitable opportunities and the impacts that are solely based on race. And then we have the structural piece of it, which occurs across institutions and society. This is what First Year Cleveland focuses on. We want to specifically address structural racism. The issues that we see from the time of, individuals being birthed at healthcare systems, through education systems, through housing systems, and so forth. We know that there has been systematically privileged, there have been factors that systematically privilege white people and disadvantage people of color. We can no longer turn a blind eye to this. And we see this through the lens of the issue around infant mortality. So our core thing is to address racism. We want to dismantle it. We want to pay particular focus, special focus on structural racism. And as I mentioned, we're not making assumptions about this. There has been literature about racism and the impact that it has on maternal and infant health outcomes. We have celebrities, athletes, public figures that are starting to come out to talk about their experiences, their birth experiences, their encounters. Even if it wasn't birthing, them experiencing racism in different systems. In particular, we've had many around healthcare, their experiences with physicians and staff and not listening to them. And then when we talk about racism, we know that there are symptoms of them. A lot of people, when they think about racism, they think of it very in overt terms, that someone's saying a racial slur, or they may be spraying them with water hoses, or things that we've probably seen within the Jim Crow era. But many times, especially when we talk about daily encounters, it's shown and it's seen and experienced through what we call microaggressions. So these are these everyday encounters, these verbal encounters, these nonverbal encounters that create hostile environments. They create toxic environments. So what you see before your screen are common microaggressions, verbal microaggressions. Some that I have listed here is: your name is too hard to pronounce. Do you have a nickname? You are so articulate. I'm not a racist. I have Black friends. When I look at you, I don't see color. Everyone can be successful if they work hard enough, pull yourself up your bootstraps. And as a woman, I know what you go through as a Black or brown person. The harm in these comments are that they can be easily explained away. So if I'm in a workplace, if I'm out and about and someone makes this comment to me and I feel disrespected, if I feel that this is very, harmful comments, the other individual may say, oh, I didn't mean that. Oh, that's not how, you should take it, and don't worry about that. And that's not what I meant, and things like that. When in fact, there is harm, there's hurt, there are negative feelings around these comments. When you tell me that you don't look at color, you don't see color, that's essentially saying that you don't see me as a Black woman, that you cannot fully try to understand when I share my experiences of being a Black woman in America and dealing with racism and dealing with microaggressions. It will not allow you to really hear me and see me. And what I would prefer that you say is that you will not discriminate me based on my skin color, that you will not judge me based on my skin color, that you will not treat me differently. So I encourage individuals that have used this phrase before or that have experienced someone saying that we change the narrative and say, when I look at you, I see your color, I see you as a Black woman. I'm going to listen to your experiences, but I will never discriminate you based off of that. So that gives you an insight of that. And we know that these microaggressions build up over time. They have an impact. So when we talk about the biology of Black women versus white women, there's nothing different genetically. But we know that racism, the impact of racism has an impact on our health over time. And this is this concept of weathering. It describes how the health of Black women deteriorates at a faster rate than white women because of the cumulative effects of racism and toxic stress. This helps explain, as I mentioned before, why Black women with advanced degrees are dying at higher rates than white women with least amount of education, why their babies are dying at higher rates. We have to understand the impact that racism has, the impact that these microaggressions have, the impact that bias have on Black and brown women. So our reducing racial disparities action teams, we have 3 of them. We have action team 1, 2, and 3. Action team 1 focuses on addressing bias within our healthcare systems. Action team 2 focuses on supporting families who've experienced pregnancy and infant loss. That includes miscarriage, stillbirth, and infant loss. And then 3, really focusing on toxic stress in Black women. And I'm going to talk to you about some of the work that we've been doing within these action teams. So the core work is understanding that, yes, we have these disparities in birth outcomes, but what's really underneath this iceberg? We have the weather, we have racism, we think about housing, unemployment, our neighborhoods, we think about policies and procedures, family support. This is how we view our work. And we're really trying to hone in on what's going on underneath that iceberg. How can we tackle that? How can we improve these conditions to improve maternal and infant health outcomes, especially as it relates to Black maternal and infant health outcomes? So action team 1, as I mentioned, focuses on addressing bias in our healthcare systems. This action team started off with conducting focus groups with Black women, white women, and Latinas in Cuyahoga County who received prenatal care and birthing care and postnatal care at one of our 3 major healthcare systems. And we talked to these women and they shared their experience, and no surprise to me and many of the people on our team who've been doing this work for so long, that there are vastly differences between Black women and Latinas versus white women. So I'm going to read some of our patient experiences that we found through these focus groups. The first one is, I was tired and my mother was speaking to me in Spanish because I was scared. The doctor stopped what he was doing, looked at me and said, this is an English speaking room only. The second one, with my first son, my man is dark and my son is light skinned. They looked identical otherwise. This nurse looks over his shoulder and says, they do DNA tests for free. So you think about these 2 quotes, you think about these experiences, and you think about what did these women feel? Now, how did they feel, experiencing this? That you're told that this is an English speaking room only, that someone is making a comment that there needs to be a DNA test. That shows that you don't understand genetics, that you don't understand the Black experience. And for me, this is personal because my parents are darker skinned than me. So to imagine that you're just having a baby and to someone to say this about the skin complexion of your newborn child, that's angry. And this is how these parents, these mothers felt. Here's some more. I felt rushed to leave, but who was waiting at home for me? We want the people who care for us to care. I'm a person, not a product. And we heard this so many times. Yes, we understand that staff, they have policies, they have procedures about getting patients in and out of the healthcare system, maybe in a certain time. I received some feedback in other presentations when I shared this information. But at the end of the day, are we being transparent? Are we informing our patients about the process, the discharge process? Are we ensuring that they have the support that they need during their stay and after their stay? Are we treating people as an assembly line? Get them in, get them out. These are concerns. These are valid concerns that the women expressed. And within our Black and brown women that we did interview, they express feelings of being disrespected, dismissed, and disregarded in our healthcare systems. This is not in New York. This is not in California. This is not somewhere else in a different state. This is right here in Cleveland at one of our 3 healthcare systems. We would never say which system they attended, but it's important that we know that, I feel that we have, excellent healthcare systems. We all know that. The best of the best, awards for many departments and programs and for leaders. But how are we treating our patients who walk through those doors? How are we treating our Black and Brown patients who walk through those doors? And these quotes, and these are just 4 quotes that I shared with you, we have many more, that tell us that this community mirror, that this is something that we need to change. Now, there's a problem, and we need to look at this, we need to take it seriously, we need to listen to these patient voices and make significant changes to improve their experience. So we took that information through the focus groups, and we created bias awareness campaigns, poster campaigns. And you will see 2 right before you. These are actually the UH posters, but Cleveland Clinic has posters and Metro Health has posters. And these will only be placed in where the staff are. So it won't be public, patients won't see this information. But the idea is that clinicians, leaders, and staff can click on the QR code, and it would take them to videos where we actually have videos of those patients who are sharing their experiences within the system and their suggestions for improvement. We have clinicians within our healthcare systems talking about bias, what we need to do, the importance. We have messages from all 3 CEOs who are supporting this work that we're doing through First Year Cleveland to say that we need to address bias, and they support us 110%. So these posters just started being launched within the healthcare systems, but we're going to do some evaluation. We're going to see how they are received, and across the awareness, and to really understand if they make a difference. How can we take this information of talking about bias, having the patient voices drive this work, and what can we do to make some changes? And this is for the staff, but really we're addressing bias throughout the entire system. So we just can't, as I go back to talking about the blaming and shaming, this isn't just about physicians. This is not just about nurses. It's anybody who is working within these healthcare systems. We have quotes from women and men who talk about parking attendants, when they talk about walking through the doors initially for an appointment, if they're walking around asking for someone for directions, the issues that they have faced, the comments that have been made to them. So this is just not about providers. It's about everyone at every level. This is about really addressing HR, our policies, our practices, the people that we hire in positions. We're looking at the system as a whole. And I just want to emphasize that point. So as I mentioned, we're conducting bias training. So we have these posters that are placed in the hospitals, and then we have bias training. And this is an important piece of it because we really want individuals to understand and know what bias is, and then what they can do to mitigate it, what it looks like, to bring that awareness, and how it may appear in day-to-day encounters with colleagues, not just patients, what they could be doing in their personal lives and their professional lives. So we have this bias training with healthcare system leaders, clinicians, and staff. It's all patient points of contact, as I mentioned before. So OBGYN, NICU, pediatrics, emergency department, et cetera. I'm really going to focus on HR transformation. As I mentioned before, talking about the practices, the policies within our healthcare systems and different programs, and what can we do to address this issue around bias. We received a grant from March of Dimes. They created a bias training that specifically focuses on maternal and infant health. We're really excited about this. It's recently being launched in 2 of our healthcare systems. And I really like their curriculum because it provides a historical context of racism in America. Many bias trainings really just focus on bias, and they don't really do a deeper dive. But we wanted to make sure that we found a curriculum that would focus on what we need to do is cultural competency is great, bias is great, but we have to focus on anti-racism strategies. and approaches to addressing health disparities and health inequities around maternal and infant health outcomes. So that was Action Team 1, talking a little bit about their work. And next we have Action Team 2, which is also called our Pregnancy and Infant Loss Society. You can learn more about the PALE Society, as we call it, by going to paleconnect.org. I would say that this is the heart and soul of First Year Cleveland. It is driven by the voices, driven by the work of men and women who've experienced stillbirth, miscarriage, and or infant loss. And these are a few photos of our wonderful and phenomenal parents who make up our Pregnancy and Infant Loss Society. So Sabrina Roberts and Tracy Carter are the co-chairs of the PALE committee that the PALE Society was birthed out of. And they were very determined to make sure that we really highlighted the experiences of Black women in Cuyahoga County. So we started off by creating a film. It's called Toxic: A Black Woman's Story. There's the website at the bottom if you want to learn more about it, and it is available for purchase. This film is a partnership between the PALE Committee and the Healthy Neighborhoods Committee of the Healthy Cleveland Initiative, and is a short film that really explores the day in the life of a Black woman and explores racism, it explores bias, it explores microaggressions, and how that impacts maternal and infant health outcomes. We have a film discussion guide. The purpose is to show the film and then afterwards have a discussion around it. And we have been screening it during the medical grand rounds at our 3 major healthcare systems right here in Cleveland. It has been well received. It is an educational tool. It's not only just to help healthcare providers and leaders and staff, but we've been screening it across sectors because we know that this issue just isn't about healthcare. So we have for-profits, we've had nonprofits, we've had different organizations, grassroots organizations. It's been in 4 film festivals across the county. We've had responses from across the country of people purchasing the film and really lending to an important conversation around maternal infant health, the Black woman's experience. Why do we have these poor health outcomes and what can we do? So it's really to start that conversation to figure out strategies to address it. Through our PALE committee, our PALE Society, we also have our wellness network. So one thing that we learned through talking to our families who experienced pregnancy and infant loss was that many who experienced the loss after they left the hospital or after the loss occurred, they had nowhere to go. They felt that they were kind of left out there to try to figure out this new normal, and they wanted support. Majority of the members within our PALE Society are Black, and they said, we want to make sure that we have people who understand our experience to provide support for us. So we created our wellness network. It is a mental health, behavioral health network that is comprised of African American licensed therapists and peer specialists. They are available to provide free healing support to individuals who are pregnant, new parents, or have experienced miscarriage, stillbirth, or the loss of a baby before age 1. That's the phone number if you want to refer anyone, or if you need services yourself. The wonderful thing about our wellness network is that this is addressing a need that wasn't being met within our community. People feel like there are behavioral health options, but there weren't a lot of Black mental health professionals available. People felt that they wanted to connect with one another. They wanted to find a circle of individuals that could support them. That's why we have the PALE Society. Many people have felt that, our systems need to refer individuals after this loss to organizations to make sure that they're connected within our communities, and OWN has fulfilled that. So it's been another great new addition to the services within our community, culturally tailored. And this is a picture of our inaugural class. We have 24 mental health professionals and peer support specialists in total. This is just a photo of our first group cohort. So it just shows you the dedication. Many of these individuals have experienced pregnancy and infant loss themselves, so they are connected to their work. They found ways to turn their pain into purpose. And this is the way that they do so. So it's just an honor and privilege to work with all of them. And we have just found just a great reception over the services and what people have told us after they have called the number and met with some of our mental professionals and peer support specialists. And then we have Wave of Light, which is an annual event on October 15th, which is also Pregnancy and Infant Loss Remembrance Day. So this is an opportunity for parents and families who've experienced loss to honor their babies. You know, when you experience that loss, you know, you don't have graduations, you don't have kindergarten graduations, you don't have high school graduations, you don't have some of those moments to hear your child's name being called. So Wave of Light gives those families that opportunity. During the ceremony, their baby's names are read and they light a candle in honor of that baby. It's a very special event. Even though due to COVID, this year's event had to be virtual, it was still wonderful. It was just as impactful that I feel like than the other in-person ones. So it was well received. And then our in-person Wave of Lights is just so powerful, just to see all those families come together and just not even support the families within their own family, but then other families. And they have maintained relationships through this process. So when I talk about improving maternal and infant health outcomes, it's also about what are we going to do to support those who've experienced loss in our community. You know, when we see that we have these high infant mortality rates, we can't look at it just as numbers and data. We have to realize that those are people behind those numbers who've experienced tragic losses that are fighting every day to make it through the day, to find purpose in life and support that they need. You know, the holidays are difficult. Every day is different for them. And so for us to have the Pale Society, for us to have Wave of Light, a lot of people have said it's been their saving grace. It's helped them through their darkest moments. And as a community, we have to uplift one another. We have to support our families. Prevention is important, but also that support for those who had unfortunately experienced this loss. Within our community and through the help and support and funding from First Year Cleveland, we know that there are doula programs. First Year Cleveland funds home visiting, case management, health education, community health workers, studying pregnancy, fatherhood programs, our Safe Sleep Heroes, smoking cessation programs, and faith-based initiatives. So First Year Cleveland has been very focused on making sure that we provide funding support for these programs, knowing that many of them work and have been successful in improving maternal and infant health outcomes. And there's more information on firstyearcleveland.org if you're interested, or you can reach out to me if you want to know specifically what we're doing as it relates to the support. I want to make sure that I'm very clear. While many of these programs are helpful, they help families through and around issues that may arise, they're temporary solutions to a certain extent. Once the pregnancy ends, we often return families to the same conditions that require the assistance in the first place. This is a problem. We have to realize that, yes, we have amazing, wonderful, successful programs right here in Cleveland, right here in Cuyahoga County, that there are deeper issues that we must address if we want to really improve maternal and infant health outcomes, especially if you want to focus on improving Black maternal and infant health outcomes. We can no longer treat people's illnesses without changing the conditions that make them sick. I think sometimes this is a thought process. This is how people design programs. This is how they design organizations and interventions, but it hasn't been working. It's ineffective. While the mother is the environment of the developing fetus, the community is the environment of the mother. So that's why I always go back to that slide about the community mirror. The community is the environment for her. We have to focus on improving the environment in which she lives in. And when a flower doesn't bloom, you fix the environment in which it grows, not the flower. So it's another powerful quote. We can no longer blame and shame mothers and fathers. We have to do something about our environment. We have to do something about what's taking place within our systems. We have to look at the policies. We have to look at procedures. We have to address racism. and the environment the toxic environment that it causes. That led to racism is a public health crisis. The declaration that the city of Cleveland and Cuyahoga County made late last year. We know that structural racism has always been a pre-existing condition. When we talk about COVID-19, when we talk about some of the health disparities and health inequities that we see, the underlying issue has been structural racism. We see the disparities. We see the number of disproportionate Black and Brown individuals that have higher rates of diseases and illnesses compared to other people. So First Year Cleveland, along with Birthing Beautiful Communities, NAACP, United Way, and Urban League of Greater Cleveland and the YWCA of Greater Cleveland came together, and they said, we are going to move forward with working with the city of Cleveland to declare racism as a public health crisis. This was our charge. We had a conference in 2019, a summit in 2019, to commemorate 400 years since the first ships arrived to this country with slaves. Well, Africans too enslaved, excuse me. And from that, our call to action was to declare racism as a public health crisis. So we worked with members of Cleveland City Council, and then over the summer of 2020, it was made official with the declaration, and we have been working hard to make sure that we carry this work forward, that it does not stay and remain on a piece of paper, but that we really examine what is going on within the city and what can we do to improve health outcomes. And this is a photo of one of our hearings where we went before the city council to talk about the work that First Year Cleveland's doing and our other partners and this declaration around racism as a public health crisis. So what's next? I know this is a very heavy slide, but I did wanted to give you some insight on what we're doing. So the purpose of this declaration is to create working groups that we can focus on health, public health and environment, housing and infrastructure, education, wealth creation and economic mobility, and criminal justice. This will be a city of Cleveland, heavily involved grassroots, local organizations, leaders coming together to figure out what we can do. You know, what are some strategies that we can focus on to make some sustainable changes within our city. We want to identify clear goals and objectives, including specific benchmarks. The focus is on promoting equity and eliminating structural issues that create racial inequities. There's a strong focus on dismantling racism, you know, developing tools to engage actively and authentically with communities of color. We cannot do this without our community residents, as I continue to emphasize in this presentation. We want to train all elected officials, staff, funders, and grantees on bias and anti-racism approaches. We want to make sure that we look through codified ordinances, our human resources, vendor selection, branch management, other internal and external policies and practices through an equity lens. You know, when we think about policies, how are they impacting Black individuals in our community, Brown individuals in our community? And what changes do we have to make? What's working, what isn't working? So we are, you know, this will be challenging, but we definitely want to galvanize our community, make sure that you can't fix something that you don't acknowledge exists. So that's the important thing, that we have to make sure that people understand that racism is a public health crisis. And, you know, we're going to outline some things of what we can do to address that. So the challenge is head on. We're going to face it. We encourage your support, and any way you can reach out to me if you would like to be involved in some way. But this is very important. I know Cuyahoga County has, they made their declaration and they have their working groups and some information that's been disseminated on the community of what they're working on. But this is important that we face this on all levels. So I leave you with, you know, I've spoken about what we're doing at First Year Cleveland, the importance of really understanding the impact that racism has on maternal and infant health outcomes, you know, what we intend to do as far as the declaration within the city of Cleveland. But I charge you to really think about how you will help our babies reach their first birthday, whether it's being involved through First Year Cleveland and some of our partners. If you carry this information to someone else, I hope that you don't hold it right here in this space. We have to increase awareness and education. If you think about taking bias training, looking into anti-racism resources. If you're out and about and you hear comments, disparaging comments made, standing up, addressing them, making sure that you're not complacent. Silence is inaction. So we can no longer be silent and turn a blind eye to some of these issues. So I encourage you to really think about your role, your organization's role. What is it that you guys are doing? Is it effective? What changes can be made? What support do you need? First Year Cleveland can always be a resource, but feel free to reach out to me if you have any questions, if you'd like to be involved, and I'm happy, or discuss any of the things that I mentioned in this presentation. I'm happy to continue this conversation with you and your organization. And here's my contact information. So thank you all very much for your time, and I'll take some questions.
Thank you so much for the presentation. If anyone has questions, you can type them into the Q&A feature, or you can use the raise hand feature and to request that your microphone be allowed to turn on. We have one hand raised. I believe you can now unmute if you'd like.
Hi, Sarah. My name is Keisha Deutsch, and I work at the School of Nursing. Cain's contact information, I was not able to write it down that quickly. Thank you so much.
I can reshare it. There it goes.
Hello, my name is Michael. I'm a student in the Consortium of Eastern Ohio Master of Public Health program, I'm based out of the Cleveland State University. I was wondering, how are you going about evaluating the efforts in healthcare settings, specifically with your, I guess, like with the posters and the educational aspect, like educating the workers in the healthcare field? I guess, like, what are like signs of success for you in that field, or in that area? Excuse me.
That's a great question. We're actually right in the middle of that. For the March of Dimes, they have an evaluation team that we'll be working with. And from our end of First Year Cleveland, we're actually right in the process of trying to think that through on what that evaluation will look like. What the benchmarks will look like around awareness and knowledge and behavior. If we would do creating some tools where we can continue to speak with healthcare providers. We want to look at even patient satisfactory. If we need to look, we know that there's questionnaires, but do we need to have a more in-depth version of them to really get at the core items that we want to assess? It's not just about your stay, how does your doctor make you feel, X, Y, and Z, but kind of getting more into, similar to the questions that we asked for the focus groups. What's really your experience been like? Do you feel safe? If you have concerns, are they being addressed? Have you experienced issues around racism? So I think that's what we will move forward towards, some of those deeper assessments and evaluation. But I can definitely keep you updated. These are conversations that we've just started within the new year that we plan to roll out within the next few months for that evaluation.
Awesome, thank you.
You're welcome. Thank you for your question.
Yep.
Any other questions? Please use the raise hand feature. You can type them into the Q&A feature, which you can see in the toolbar, the bottom of your screen. If there aren't any other questions, thank you again so much for this wonderful presentation. Really appreciate you presenting today, and we really appreciate everyone joining us for our seminar today. Our next seminar is going to be on February 10th. In 2021, we will have Dr. Alana Radusky from Medical University of South Carolina, who will be presenting on addressing barriers to tobacco treatment for people with comorbid conditions in a healthcare setting. You can register for our seminars at our website. Please visit, it should be in the chat feature, as well as see any recordings for this presentation, which should be up later this week, as well as ones we've had in the past. Thanks and have a great rest of your day, everyone.
Thank you all.